have you been dealing with inflammation, or have you been told that you have some sort of inflammation? Maybe there are symptoms of inflammation that you're dealing with. So in this video, I'll talk specifically about ways that I think about inflammation, ways to prevent it, and things you can do to reverse any damage caused by inflammation. My name is Dr. Mohammed Ashori. I'm a board certified family medicine physician, and I create these videos specifically about healthy aging because I think once we have achieved some level of health by the age of 30, the goal is to prevent any kind of chronic disease development, which has a lot to do with lifestyle and living healthy and feeling well. Inflammation on a molecular level is when the body creates certain molecules or chemicals, or there is what we call oxidative stress, where the body is not able to repair itself, or certain structures of the body develop damage that kind of persist, and that can manifest either silently or it can manifest in symptoms such as bloating, fatigue, skin changes, weight gain, all sorts of other complications, even blood sugar and endocrine problems. My body, the way I can tell there is maybe some inflammation is if I develop certain rashes in certain parts of my body, my digestion might be off, and my focus and attention will fade. I have other patients in whom inflammation presents as a certain joint flaring up, as their skin being super dry, their hands getting clammy and cold. So it's different for every single individual. And to become aware of your body, to become aware of your physical body and how your body particularly manifests inflammation is sort of an art. And the more you pay attention to symptoms, the more you write them down, the more likely it is that you'll kind of figure out what your inflammation signals are. Is there a diet that you can follow? Are there anti-inflammatory foods? I don't think about it that way. It's more about foods that might cause inflammation in you. Starting at the very top of that pyramid, I would probably get rid of any kind of ultra-processed foods. For most people, that's going to create some level of inflammation. The next level might be creating a food, mood, poop journal, as the functional medicine community talks about, which is basically writing down the foods that you eat and then writing down the symptoms that might cause you some inflammation or irritation in your body, and then paying attention to your digestion. That journal will give you a really good idea of what specific food groups might be causing inflammation in your body. Based on the research and based on my experience with my patients, there is absolutely no way to predict that one particular food like animal products or dairy or nuts or eggs or gluten consistently will cause inflammation in people. Certainly, if you have a lot of one thing, it might cause a certain bit of disruption in your body's natural homeostasis, but in general, it's unique for every single person. It's fair to say that gut health has a lot to do with inflammation, and the reason for that is that our intestines harbor certain bacteria, and they produce certain hormones that are integral to the function of our body. So certain bacteria create certain byproducts, and if we have the kind of food that feeds the good bacteria in our system, it's fair to say that it can help mitigate or control inflammation. You can go as far as to take probiotics and prebiotics, but once again, it's more about paying attention to certain foods, especially the ultra-processed stuff, and trying to introduce more of the good stuff and see if you notice any changes in your inflammation symptom. Maybe another level would be to try to do things that decrease inflammation or at least help the repair in your body. So for example, controlling your stress through simple mindfulness can make a big difference. I have patients who previously thought that they're quite intolerant to certain food groups, specifically nuts or certain types of fats and gluten. And once they adjusted other parts of their life, such as their stress and sleep, they no longer felt those same inflammatory symptoms. For example, acne, oily skin, hair loss, back acne, vaginal dryness, erectile issues. Those are common inflammatory symptoms that people complain about, and they can be controlled with simple lifestyle changes. One way to track inflammation, again, is to just write down your symptoms. It's simple, like today I woke up and I'm super fatigued, or I'm exhausted, or my eyes are dry, or my skin looks different. Any of those things can be good signs and symptoms or signals of how your body is responding to the environment. The next level might be to do some blood tests. Of course, I've talked about this many times on my YouTube channel here, but also on the website at drashori.com. Simple inflammatory markers might be CRP, ESR, homocysteine, but they're not always elevated. They don't always go up when you have inflammation. Vice versa, we can say some people might have slight bit of inflammation based on biomarkers, on blood tests, but they don't have any symptoms of it. If I have a patient who has elevated inflammatory markers or symptoms of inflammation, yes, we start with a diet like I've already talked about, and then we go through exercise regimens and stress. In fact, for me, stress comes first: stress, sleep, mental health, and finally we'll address exercise. Are they getting too much exercise? Are they doing so much exercise in their body that they're actually reacting negatively? Or are they sitting down so much that their body's really not getting enough circulation to the important tissues? And finally, supplements. I won't say finally because I got two more points I want to hit on, but supplements are often the first go-to for many people who come to me, to drashori.com. But I think it should really be at the very end of the chain of management options, because you can introduce all these supplements, omega-3 fatty acids, magnesium, turmeric, but you don't really know, is it the lifestyle habit, the dietary changes, the exercise stress management, or is it the supplements that are making a difference? And supplements should be introduced, but there's a question of whether they should be taken forever or only used during very specific times. And so that's kind of what we talk about in my practice with patients. And of course, food variety is important. If you're eating the same thing over and over, sometimes you can get certain toxins in the foods. Of course, we know about toxins such as additives in the food, but there is also pesticides and there is fungicides. And if you're eating the same food over and over, especially if it's coming from the same source, you can sort of concentrate those chemicals in the body. So it's nice to have some variety in your diet. The last thing I'll mention is the prescription medications that certain people take. Fortunately, most prescription medications, I would say they don't cause a lot of inflammation in the body, but certain people are quite intolerant. When you think about beta blockers or even certain antidepressants, they're just experiencing symptoms that they can't cope with. And in some people, it manifests as inflammation. In fact, their inflammatory markers in the blood test might go up. I would never recommend to just completely stop your medications, but you can talk to your doctor about adjusting dosages, trying a different medications. Very rarely, some people will switch from generic to brand and their symptoms improve. But again, that's a very small percentage of my patients. So that's it. That's a little bit about inflammation. I hope it gives you an idea of how I think about inflammation, how we discuss things with my patients. Keep that journal. That journal is so powerful. When you take it to your doctor and your doctor has the time to sit down with you and go over that, you can discover incredible insights from it. If you want more information, go to drashori.com. Leave your comments below. Tell me about any symptoms of inflammation that you've experienced. Take care, guys.